American College of Rheumatology came out with their new gout guidelines really because of a need that the treatment of gout over the past 50, 60 years has been really muddled in a lot of misinformation and misdiagnosis, and the use of the currently available drugs hasn't been adequate. We know that probably less than 10% of all gout patients are getting what we would consider and what the gout guidelines would say is adequate therapy. So this puts together all of the various approaches both for diagnosis and for treatment in one place, and it shows the evidence base for these decisions. All healthcare providers that are taking care of patients with gout should be aware of the guidelines. They should understand what the standard treatment is, because frequently these standards are not currently being followed by practitioners in this country and around the world. They should know our goals of treating to target as far as lowering uric acid. They should know the difference in the medications, those that are used to treat the inflammation of gout versus those that are used to lower the serum uric acid level. They should also understand and appreciate the stages of the disease of gout. That gout is a disease of slowly accumulated uric acid over years and decades, and the treatment really at its core isn't just getting rid of pain, but really getting rid of this uric acid burden, and that's all contained in the guidelines, and I think it's very incumbent on all healthcare providers to understand these very basics about gout. One of the important things that the ACR guidelines is promoting is education. Education both for the patient, which is certainly one of the reasons that compliance with their medications is poor, but I also view it as education for the healthcare providers and physicians that take care of them. Again, putting together all of these concepts of how we recognize and diagnose gout, what are the important clinical features so that we're not misdiagnosing and treating somebody inappropriately, but once we've made that diagnosis, how we discuss with them the disease itself, how we discuss the lifestyle modifications that they should go through, and then what the importance is of each of the types of drugs that we use. All of those are very important. Currently, about 90% of all gout patients are managed by primary care physicians, and most gout patients can be handled adequately in that environment. If there's more advanced disease, if there's lots of tophi, if there's crippling arthritis, I think those should be sent to rheumatologists. I also think if there's a burden of comorbid diseases like diabetes and hypertension and chronic kidney disease, because of the restriction of the drugs that you have to use in that setting, maybe a rheumatologist would be helpful then as well.